ए सुनो सुनो खाली
Very good afternoon to one and all. I am Arpita, the moderator for today's session. The topic that we are going to cover today is updated recommendations of vaccination in neonates, the National Newborn Care Week that we are celebrating. This webinar will be an insightful one on focused on latest updates and recommendations in neonatal vaccination as we celebrate the National Newborn Care Week. Vaccination is one of the most effective ways to prevent infectious disease in neonates and young children. The immunization schedule for neonates has been updated to ensure that infants are protected from severe disease as early as possible. And yes, to address the topic, we have with us someone very eminent and he's very well known to all of us. Still, a bit of introduction to start with the program. None other than Professor Dr. Sunil Kumar Agarwala, sir. He's a professor at the Department of Pediatrics. He has completed MBBS and MD. So is a recipient of numerous awards like the Chikitsak Ratna Award in 2006. He is a Pioneer Award in 2009. Dr. Agarwala has special interest in pediatric neurology, infectious disease, and HIV. Sir has many international and national publications. So, with this very brief introduction of Sir, now I will request him to please take over the session. Over to you, Sir. Sir, you are on mute.
अच्छा
Yes, sir. Go ahead.
am I audible now?
Yes, sir, audible.
अच्छा okay. Dear doctors, welcome to this IJCP webinar. And आज we are celebrating newborn week. And as we all know that there are many vaccines has to be given from 0 to any age. Age is not a bar. Vaccines do not save lives. It is vaccinations do. That means if we are having vaccine in our vaccine carrier or in our ILR or in our purpose-built refrigerator, that is not going to save lives. It is the vaccination. If you are giving the jet or you are giving the antigen inoculum into the patient, then only it is going to seroconvert and it will stimulate the immune system so that the antibody will be formed, memory cells will be formed, and it can protect. Now coming to age, neonates. Now, what are the vaccines can be given in the neonates? So my topic will be what are the updation in the recommendation of vaccines in the neonatal age group. Now, having said that, before going to the vaccination in neonates, let me tell you that this, whenever we are going for any vaccination in our country, particularly we the pediatrician get and take the major chunk of this vaccination in our country. One part is that 91% of the vaccination they do occur in the public sector. Only 9% of vaccination is catered by the doctors. What are the recent most immunization guidelines followed in India? See, one is here. If you see National Immunization Program 2023, the same is going on this year as well. If you see here, what are the vaccines? They are known as birth dose vaccine. You see here BCG is given at birth. Zero dose polio is given at birth, that is OPV, and now everybody knows it is a bivalent polio. Hepatitis B, zero dose is given at birth. Now, 6, 10, 14 weeks pentavalent vaccine, then 9 months is nowadays crowded because of the PCV booster. And last year, 2023 onwards, all over India, the pneumococcal conjugate vaccine, particularly PCV14 from Biological E and PCV10 from Serum Institute of India Limited, they are already rolled over pan-India, almost all state and union territory across our country. Then first booster is given in the form of MR2 and DPT1 booster, OPV, and JE second dose is given at 1.5 years. Then comes your school going age, that is DPT booster, second booster, 10-year TD, and 16-year another TD is there. Having said that, each pregnancy we are going for 2 doses of TD, that means 1 month apart. If the pregnancy happened within 3 months of the previous pregnancy, then we are going for TD booster. That's all. So this is the national immunization program updated we are following. But coming to my topic, what are the neonatal vaccination? You see here, that are the three: BCG, OPV, and hepatitis B. So I will go to another vaccination schedule. Which one is this? This is known as IAP schedule or otherwise known as ACVIP schedule. IAP means Indian Academy of Pediatrics. ACVIP means Advisory Committee on Immunization Practices 2023 and 24. Here you see the same BCG is there, same OPB is there, and hepatitis B is there. So this vaccination, whatever we are giving, that is, I mean, in the birth, that is same in both the schedule. Let it be government schedule, let it be IAP immunization schedule. So that means both the schedule they recommend BCG, oral polio vaccine, and hepatitis B. There are some differences later on 6, 10, 14 hexavalent vaccine in office practice, Rota 1, 2, 3 and PCV 1, 2, 3, that is 3 plus 1 schedule, 1 booster we are giving at 15 months. Flu vaccine is recommended at 6 months plus 1 dose of typhoid conjugate vaccine. Then flu is given every year till the age of 5 years. MMR1 is given at 15 months, hepatitis A1 is given at 12 months. Then second dose of MMR, varicella 1 is given at 15 months, 18 months. The booster is given in the form of pentavalent, because sometimes pan India there is shortage of solo hepatitis B to be given at birth. So now we are giving hexavalent vaccine as a booster at 1.5 years. But never forget 4 to 6 years, that is again DPT full along with 1 IPV, that is tetravalent vaccine, and third dose of MMR is being given at 5 years. 10th year vaccine, we know TDAP is given, then thereafter TD vaccine every 10 years. There is no vaccine at 16 years. And HPV vaccine nowadays is recommended both boys and girls in the age group of 9 to 14 years. This is now new inclusion, that HPV vaccine has already been there, has a placement in our IAP schedule. Irrespective of boy or girl, we are giving that. So coming back to my topic, first thing is that which are the vaccine? They are known as birth dose vaccine. Any vaccine which is given in the after birth are known as birth dose vaccine. What are they? Number 1 is BCG, number 2 is oral polio, number 3 is birth dose of hepatitis B. Coming one by one, what is the meaning? That all birth dose vaccines or at birth vaccines preferably to be given within 24 hours of delivery or within 1 week after delivery. That is the definition of at birth or birth dose vaccine. Now, first thing, BCG. BCG is a live vaccine. It contains Mycobacterium bovis, live attenuated bacteria. It is given universally on the left side of the upper arm at the insertion of the deltoid intradermal. Till 4 weeks, we are giving 0.05 ml. After 4 weeks, we are giving 0.1 ml intradermal. And we all must know that all preterm babies, even if they are preterm, even if a VLBW baby like less than 1.5 kilo or extreme low birth weight babies less than 1 kilo, if they are vitally stable, if they are hemodynamically stable, then we can offer BCG vaccine. And after BCG vaccine, 2 to 8 weeks within, there occurs a small abscess formation, and that abscess burst out and giving rise to a scar, most likely within 3 to 4 months of vaccination. But always remember, 10% cases of BCG taken children, they may not mount a scar. Absence of scar doesn't mean that absence of BCG take. So if absence of scar is there, scar is not there, and you see there is a documentary evidence, many school of thought says that you may not repeat the vaccine, or some school of thought says nowadays, as per the Purple Book of Immunization Guideline by IAP, that you can offer 1 dose of BCG vaccine after 6 months of BCG vaccination. So that is all about BCG. Now in BCG, if you are giving in an immunocompromised host, for an example, baby born to a HIV positive mother, that is number 1. 1 or 2 siblings died before with a known condition known as primary immune deficiency. In those situations, let it be primary or secondary immunodeficiency, we have to diagnose the immune deficiency condition in this present child. Then only we can jolly well go for the BCG vaccination. Otherwise, this BCG there occurs bacteremia, and sometimes we may land up with BCGosis or disseminated BCG reaction. In them, we have to go for 9 months to 18 months of ATT, but always remember in BCGosis, pyrazinamide has no role, and we have to go with aggressive ATT management for a longer duration of action. Now coming to OPV. What is OPV? This is a oral polio vaccine. Now in IAP schedule, that is the only placement in the birth dose this OPV is given. And this OPV, why it is given? It has been seen that even if transplacental transfer of antibodies there which are IgG, they are really not going to interfere with the OPV tech because they are IgG, they are not IgA. So that's why OPV, the seroconversion may be 10 to 20%, but it has been seen the subsequent doses of polio containing vaccine, the mounting seroconversion is very good and incidences of BAP is less once OPV primed children. So that is the reason even after all everywhere you see IPV, and even one IPV booster at a school going age. So that means only OPV is given single setting where OPV is recommended, that is at birth, and 2 drops of oral polio vaccine is given. And the purpose is being that it is going to elevate the immunological response of polio containing vaccine in the form of IPV, and the subsequent BAP percentage and incidence will be low. Now coming back to NIP, National Immunization Schedule, we are again going for OPV 2 doses along with 6, 10, 14 and another booster at 1.5 years. So suppose we are going for this, that means one after another, whenever we are going for this vaccine. So how many doses we are giving? One birth dose, one is 6, 10, 14, another booster. That means another dose is given at 1.5 year. 5 year, 5th year, there is no OPV is given. Because more and more OPV is given, there is more and more chance of BDPV and BAP in the community. Finally, coming back to hepatitis B, it is given. And now Government of India is very proactive to give hepatitis B vaccination by our ground level workers, that is Anganwadi Didi, or you can say Asa Didi or NM workers, whoever the first line workers are going for the vaccination session in the community level, they are advised that to give this hepatitis B vaccine as early as possible within 24 hours of delivery. Why? It has been seen that the mother to baby transmission of hepatitis B antigen is being curtailed to the tune of 75% if at all only hepatitis B vaccine is given. Now, there was a question in previous 2-3 years back, if the weight is less than 2 kilo, then hepatitis B antigen immunogenicity is suboptimal. So you do not give. Now that is not valid. Now, whether it is less than 2 kilo or more than 2 kilo doesn't matter. You have to go ahead. You have to go ahead with this. That means whenever you think that it is there, that means we are thinking this hepatitis B vaccine. Whenever we are thinking, even if it is less than 2 kilo or more than 2 kilo, we have to go ahead. More than 2 kilo or 2.5 kilo, we are counting as the birth dose. And in cases of less than 2 kilo, we are not counting because anyway, the hepatitis B vaccine is given as a combo vaccine at 6, 10, 14 weeks. Now 6, 10, 40 weeks combo vaccine provides hepatitis B. Now having said that, how many doses of hepatitis B is needed? What is the base schedule? 0, 1, 6. 0, 1 month after and 6 months after. But in vaccination schedule, immunization schedule in India, we have 0, that is birth dose. But we have no option at 1 month. We are starting the combo vaccine from 6 weeks, 10 weeks and 14 weeks. So 3 doses given. It has been seen that the seroconversion to hepatitis B3 antigen 6, 10, 14 weeks is good. So many a times because of the combo nature, we are giving 1 extra dose of hepatitis B antigen at the age of 1.5 years, and that 4 or 5 doses of hepatitis B, 1 or 2 doses of hepatitis B antigen doesn't mount any interference or any added AEFI when it is given as a combo vaccine at the age of 1.5 years. So my question is that what are the vaccination schedule for the preterm babies? Now remember, preterm babies, once they are vitally stable, hemodynamically stable, you can give the vaccine as per chronological age. Now term baby, preterm baby, there is no differentiation. If the baby is comfortable, vitally stable, you can go ahead with all these three doses: BCG, OPV, and hepatitis B. If there is a baby who is staying in the NICU or SNCU because of the illness, once the illness is over and the baby is going to discharge, at the time of discharge, all vaccines can be given. So that means if the baby is going to discharge on day 6 or day 7, whatever vaccines has been left out, these all three vaccines can be offered. But however, we are trying our level best that whenever we are thinking a baby who is going to discharge at the age of within 14 days, we are giving BCG, OPV, and hepatitis B. And beyond 14 days, because we are not giving those vaccines at that point of time, because we are giving a gap of 1 month, so that 2 weeks later all those vaccines left out can be given at the age of 6 weeks. But it is not a standard rule that many a times what happens if the baby is going to discharge at the age of 28 days, at that point of time somebody may give BCG and oral polio, but hepatitis B can be given at the 6 weeks as early as possible as a nature of the combo. So there are many permutation and combination, but both dose has to be given really within 24 hours of delivery once the baby is comfortable. If not, within one week of life. If not, preferably within 2 weeks of life. If not, at the time of discharge. If it is more than 14 days, it is better to club all those left out vaccines at the age of 6 weeks. So this is all about vaccination in the neonates. Now coming to what are the things, how we are going to prevent pertussis in the newborn. What the things are recommended, how to prevent pertussis, because pertussis containing vaccine is given at 6 weeks, but we have seen a lot mortality due to pertussis in the newborn, and neonatal pertussis death is very good, I mean more lethality is more. So that means how to prevent. So it has been well thought that pregnancy, one dose of pertussis containing vaccine to be given from 27 weeks to 36 weeks of gestation towards last trimester, first TD, and thereafter towards last trimester, one dose of Tdap. Each pregnancy, one dose of Tdap is recommended so that this pertussis containing antibody can traverse via placenta to the baby, and the baby is protected till 6 weeks of life. And sometimes what we say that many a times in order to prevent the transmission of pertussis from adult to the pregnant lady, so a cocooning is being done, means other members of the family, they are giving one sort of Tdap so that the transmission of pertussis bacilli or bacteria is not possible. So this is the way we can decline the incidence of pertussis within 6 weeks. That's the reason. If you go back, the WHO has already been recommended, CDC has already been recommended one of the good vaccine during pregnancy each, that is one TD followed by Tdap from 27 to 36 weeks of gestation. We have seen the COVID time, we have given a lot of COVID vaccine during pregnancy. Initially that was contraindicated, but thereafter we have seen the pregnancy is the right time where COVID vaccine to be given. But now COVID is not a issue. It is now we are staying with the COVID virus. So that means we are not recommending COVID vaccine globally. Coming back, CDC and WHO now recommending each and every pregnancy should be covered with one dose of flu vaccine. Why it is important? It is very important for the cold countries like America, Europe, China, all those cold countries, it is very important. But having said, the India being equivalent to southern hemisphere, that is also a prevalence of this flu throughout the country as a seasonal influenza, and that's the reason. If the mother is given one dose of flu vaccine, then preferably the baby after delivery is immune by the passive transfer of the antibody till the age of 6 months, because after 6 months only we are allowed to give flu vaccine. So that is the reason. So in summary, what I say, the vaccination updated guideline for neonates suggest, number one, BCG vaccine if the baby is stable, irrespective of preterm or term, can be given. And if you are dealing with a primary or secondary or acquired immunodeficiency, it is better to postpone the BCG. Once you rule out there is no association, no presence of immunodeficiency, then jolly well you can go for BCG. Otherwise, you may land up with BCGosis. Number two, oral polio vaccine is given as early as possible, 2 drops, preferably within 24 hours, but it can be given before 2 weeks. Hepatitis B vaccine, again, in order to curtail the vertical transmission, it is to be given within 24 hours of delivery. If not given, again, it can be given up to 7 days, but more or less after 7 days, it is going to prevent horizontal transmission rather than vertical transmission. A intermediate endemic country like India, now it is important. The government has felt and it has been told on the government sector, each delivery should be covered with hepatitis B vaccine to the baby, to the newborn within 24 hours of delivery. So this is about the birth dose or at birth vaccine. Now, if the baby is preterm, born preterm, the chronological age will decide what are the vaccine to be given.
Sir, sorry
Once
to
the baby,
interrupt. Your slides are not moving.
yes, 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 yes,
This is the slide you want to show, sir.
right, exactly. Exactly. So in these vaccines, I have already told that this Tdap vaccine is one of the vaccine which is to be given during the pregnancy, and throughout the pregnancy we start with TD and another dose is Tdap. Already whatever I have told, I main intent was there that these two schedule should be there inside our brain so that at any point of time these two schedule we are going to follow up. So coming back to the summary, what I told that are many vaccines now we are giving to the adults, but these adults, whatever vaccines we are giving now one after another, these again Tdap vaccine, flu vaccine, hepatitis A vaccine, all those vaccines we are giving in the adolescent age group, provided they have not acquired that infection in the childhood. One or two line on PCV vaccine, dear doctors. Now this PCV has already rolled over in our country since last year, and it is given as 2+1 schedule, one dose at 6 weeks, another dose at 14 weeks, and another dose at booster at 9 months. Whenever we are giving an office practice, we are giving 3+1 schedule, 3, 16, 14. Already I have shown you how we are going with that type of schedule. Now, if one after another we are saying MMR vaccine, again, it is very, very important for the girls in order to prevent, we are saying a rubella baby. That means whenever congenital rubella syndrome, cataract, deafness and everything, this congenital rubella syndrome is prevented by giving MMR 2 doses in girls. Now, again, it is a gender neutral vaccine. Being a boy or being a girl, no matter, all adolescent, before adolescent age group must be immunized with 2 doses of MMR. That is the importance so that we can prevent CRS in the newborn. So that is the reason whenever we are saying, then coming to one or two line on flu, and annual flu vaccine is a recommendation in the cold countries. But however, in pregnancy, one dose, each pregnancy should be covered with one dose of flu, which is a mandate. Now, many a times we are having a lot of vaccine, that varicella vaccine. If the girl is prevented with varicella vaccine or had varicella in the back, then the newborn is being protected because the transplacental transferal of varicella antibody, and the newborn is not going to have varicella infection. So that's why otherwise pregnancy in the first trimester, if the varicella occurs, then the 2% the varicella infection can go to the organogenesis period in the newborn, can lead to zoster baby. So always remember 2 doses can be given to them. Hepatitis A vaccine, though it is a communicable disease, many a times it is being given in the adolescent period. Meningococcal vaccine we do not recommend well. That means HPV vaccine is the ideal age, where 9 to 14 years we are recommending this vaccine to be given in that age group. So one line I will tell you, there are many vaccines are there which are very important in the latter age group, but in neonatal age group, already I told the most important vaccine which we have told, that is a BCG and birth dose of polio and birth dose of hepatitis B. So these 3 vaccines are important, and during pregnancy, whenever we are saying what are the vaccines to be given, it is TD followed by Tdap, and the another dose of flu vaccine is recommended in the pregnancy. Why Tdap? Because always we tell, if the Tdap is there, then definitely it is going to prevent, or it can protect the newborn from pertussis up till 6 weeks of life, because the first pertussis containing vaccine we are giving at 6 weeks. But however, the first dose is not going to protect. That is second dose or third dose at the age of 14 weeks is going to protect. Until then, this Tdap, this antibody is coming from mother to the baby, that is going to protect. So any pregnancy, remember TD followed by Tdap and one flu is a global recommendation, and we are following that this is the vaccine of the need that during pregnancy. Why? Because not only it protects the mother, but also indirectly it protects the baby once the baby is born. It has been seen a lot of death can be prevented by all those vaccines which can be given in the neonatal age group. So before concluding, I must tell you that updated guideline first is NIP in this side, IAP guideline is on this side. BCG can be given at any age up to 1 year in case of NIP. BCG can be given up to 5 years as per ACBIP schedule. It is a live vaccine, attenuated vaccine, and whenever we are giving, the dose is 0.05 ml intradermal, that is upper arm, it is to be given. Beyond 4 weeks of life, it is given as double dose, that is 0.1 ml. Once we are giving, it is lifelong, no booster dose is recommended. One line I will tell you, nowadays this given in adults 18 years to 65 and 65 plus, everybody is recommended that one dose of BCG vaccine to be given. This is on a pilot project in our state, Odisha. 10 districts has been chosen, and this adult BCG vaccination is going on. The main purpose is that to boost the immunity, because BCG is not only a vaccine, it is an immunomodulator. It stimulates the immunity so that the overall cause mortality in the newborn is going to less. And we have seen in COVID that India did well because we have already protected by the BCG. In America and US and whatever I say in Europe, these kids are not being prevented by BCG because they are not tuberculosis naive country. So that's why they do not recommend BCG vaccine in them. Those babies who are born in America, they come to India, and particularly within 5 years and a long stay, we are offering BCG vaccine to them. In pregnancy, already I told these are the 3 vaccines to be given. Finally, the preterm babies are more prone for infection. So at any age it can be given, but if NICU stay, it is always said that the rota vaccine should not be given during the stay. Once the baby is going to home, on that day, if the 6 weeks old is there, then we can start rota vaccine, and other follow-up vaccines can be given in the subsequent visit. So finally, to sum up, in India, we have to abide by 2 programs. One is National Immunization Program, another is IAP program. Every year it is going to change. And the new guideline in both, they are saying BCG, oral polio vaccine, and another is birth dose of hepatitis B. But always remember, because this World Prematurity Day, it has happened yesterday only. And this week we are celebrating National Newborn Care Week. So it means that the neonatal mortality should be prevented by certain things. Number one, exclusive breastfeeding till 6 months of life. So that's why, what is the first vaccine to a newborn? It is not BCG. Sometimes my postgraduate, they tell it is BCG. I will tell the first vaccine to the baby is colostrum. That means once the baby is born, immediately, even if episiotomy stitch is going on, immediately put the baby to the breast, and the baby will crawl and reach to the breast, and she or he is going to suck from the breast. And that is known as the cascade of this cycle of breastfeeding, going to the breast and sucking, swallowing, the journey has started. If you delay that, then all reflexes will be inactive. Then it will be very difficult to feed that baby by putting to the breast, and a lot of issues will be there. So first vaccination to a baby is colostrum. Let us not deprive from colostrum to a newborn baby, and it is to be offered as soon as possible, preferably within 1 hour of delivery. But in cesarean mother, it can be given within 4 hours after delivery. So this has to be taken. Then appropriate complementary feeding should be given at 6 months. Continuation of breastfeeding to be continued at 2 years, and by 2 years, the proper proper complementary feeding and whatever vaccine, whatever is there, that has to be given at that point of time. One liner, this slides, one line I want to tell. Yesterday we got a baby who has been bitten by a pet dog. and this newborn is almost 7 days old. So the question was, it was cat 3 bite. So whenever we are getting a animal bite, let it be dog or anything, the schedule of the category, the treatment remains same. We have inoculated this monoclonal antibody, particularly rabies monoclonal antibody, into the lesion, and anti-rabies vaccine in office practice it is given in 4 doses, 0, 3, 7, 14. However, in the government sector they are still giving 5 doses, 0, 3, 7, 14 and 28. So even if the newborn, there is no contraindication of anti-rabies vaccination. From newborn till any age, the vaccination, the antigen amount remains same, the category management remains same. The most important part is wound toileting. I'll show you a picture how you are going to treat the wound. You see this picture, wash the area of an animal bite thoroughly. If the animal bite area, it has to be washed thoroughly. That means with the soap water under the tap water at least for 5 to 10 minutes. Then it has been seen 50% of the virus, they are being shedded out. So this is all about the updation of the vaccination, particularly in newborn. In the celebration of neonatal care week celebration, I must tell all the doctors, let us take an oath that each baby born, they should be fed with exclusive breastfeeding till 6 months of life. If there are some situation, for an example, maternal death due to PPH, or the baby is very teeny, or there is a syndromic baby, or there is cleft lip or palate or whatever, but still then EBM, expressed breast milk, can be a choice. And these vaccination, whatever I told, never forget the colostrum, never to be discarded, it is to be given. And finally, the most important point is hygiene maintenance, minimal handling to the baby, and the baby should be covered, prevention of hypothermia, and all vaccine as per the time tested chronological age, 6, 10, 14 weeks, all those vaccines to be given. And preterm baby, all the vaccines to be offered as per the chronological age if they are vitally stable. Last, many times I have seen pan India, people say अभी तक तो 2 किलो हुआ नहीं है, वैक्सीन लगेगा नहीं. Now this, the weight of the baby should come to the 2 kilo, then the vaccine will be given. This is a myth. Let us join hand in hand so that even if less than 2 kilo, as age appropriate vaccine, if the baby is vitally stable, hemodynamically stable, let's go with all the vaccine whatever is recommended at that age, rather than waiting for the weight to come at 2 kilo, because the lesser the weight, they are more prone for vaccine preventable disease and they may die. So this is all about my presentation. Now it is over to Arpita. If there are any questions, please ask me.
Right, sir. Thank you, sir. Thank you for so much for this beautiful presentation. Now let us see the questions that have come from our audiences.
Right.
Sir, the first question is, can you share insights on addressing vaccination hesitancy among patients of neonates, especially in rural or underserved areas? Sorry, among parents of neonates in rural areas.
Yes. The question is basically what is the vaccine hesitancy in a rural area? And with respect to neonates, I'll tell you rural areas. Now I will tell you in government sector, if you say full immunization, what do you mean by full immunization? The full immunization means all vaccines, including 9-month vaccine, if it is given up to 1 year. That means birth dose, then 16, 14 and 9-month dose. If it is completed, that is known as full immunization. Now, full immunization coverage in India is at par with 98% over the country. That means rural, urban, semi-urban and semi-rural, whatever you say, the take-up of the vaccine is very high, up to the 98%, irrespective of any rurality or any urbanity. That means it is pan-India, very good. So that's the reason. There is, I can say there is no hesitancy, but only hesitancy occurs when the baby is small. That means if the baby's weight is 2.5 kilo, then the mothers, those who are semi-literate or illiterate, they may not think that this is not the age group to take the vaccine, or the baby may not adjust with that vaccine because fever will be there, so they are not happy. And sometimes the myth is going on that the Anganwadi Didi, ANM, and they think that the baby is not 2 kilo plus. That's why vaccine should not be given. And once the baby attains the 2 kilo, then the vaccine will be given. Or sometimes they say 2.5 kilo is the cut point, then the vaccine will be given. So I must say there is some amount of hesitancy is there once the baby is weighing low. That means less than 2 kilo or less than 2.5 kilo. Otherwise, all the babies they know, all the mothers they know, even if they are in rural, they are very well accepting the BCG and oral polio and hepatitis B at birth. So there is no hesitancy, because I have worked 3 years in the very rural pocket and I have never seen a lady denying, because they know that whatever vaccine we give, they equate with the one terminology polio. Even if I am giving BCG, even if I am giving polio, even if I am giving hepatitis B, they tell polio, I have taken polio. That means polio is synonymous with vaccination, and that they go ahead with that. So this is the way. And in urban and everything, wherever any nursing home the baby is delivered, within 24 hours, if the mother is okay and the baby is okay, weight is 2.5 kilo plus, then immediately the sister will come and give 2 drops of oral polio, one BCG, and that. And many a times the grandmother and the elder person, they inquire whether usko tika laga ki nahi. Tika matlab, that is equivalent to vaccination. They don't know what are the vaccination, what are the composition. It is the we doctors or paramedicals, we know, but hesitancy is very, very less, negligible.
Right, sir. That is great to hear that there is awareness in the rural areas also regarding vaccination.
Yes.
So, moving on to the next question. How should delayed vaccination be managed in neonates discharged from NICUs?
Yes, it is a question I have already answered. Now think, NICU baby, if going to discharge within 2 weeks, let us go with whatever the left out vaccine is there. BCG, oral polio 2 drops, and hepatitis B at birth. And it is to be given anterolateral aspect of the mid thigh. It is to be given intramuscular. Chapter over. Now, if the baby is discharging beyond 2 weeks, let's say a baby have a very turbulent stay in the NICU and discharging on 30th day. Now, my question is that there are two options. I can give BCG, I can give oral polio and discharge. Hepatitis B, I won't give on that day, and I will call upon by 6 weeks where pentavalent vaccine or hexavalent vaccine can be given. And this is the best answer. But sometimes if you give hepatitis B at 30th day, then definitely you have to call upon for the 6 weeks vaccine, not at 6 weeks, at 8 weeks, because the vaccine gap 1 month has to be maintained. So in NICU, for an example, if a preemie baby is going to stay for 2 months plus, if the baby is 2 months plus, it has been said that you give age appropriate all the vaccine as per the age gauge. If the baby is vitally stable, then only thing during the NICU stay, rotaviral vaccine not to be given, because it is a live attenuated vaccine. There is every chance that it may outbreak cause diarrhea in the NICU. So beyond that, this rota vaccine can be offered once the baby is going home. So NICU stay, all the vaccine can be given within 2 weeks. After that, you may not give hepatitis B. Combo vaccine can be given at 6 weeks. And if the baby stays beyond 6 weeks, I will suggest all vaccine to be given except rota. Rota can be given at the time of discharge.
Uh, right, sir. Thank you. Thank you so
Ha,
much.
ha,
Moving
ha.
on to the next query.
Yes.
Sir, are there any new vaccines recommended for neonates at high risk, such as preterm babies or those with congenital conditions?
Yes, I'll tell you more the high risk. What do we mean by high risk? Suppose a baby is preterm, he is more vulnerable to infection. Baby born to a HIV positive mother, baby diagnosed to be a congenital malformation, baby diagnosed to be intrauterine infection, baby diagnosed to be any spina bifida. All those babies are potentially high risk and they can acquire infection easily than comparison with a normal baby. If you compare normal baby and high risk means what? High risk for acquiring disease. And that's the reason you can prevent by giving vaccine. So they need vaccine early. How it is possible? It is to be given. For an example, I'll tell you a 6 weeker baby who is 1.8 kilo. If I am delaying vaccine, then the baby may have vaccine preventable disease, for an example, pneumonia, and die. So it is better to protect them by giving vaccine rather than not giving vaccine. So I will say in that condition in office practice, we can offer hexavalent vaccine. One hexa, 6 antigen into 1. So one shot will be given, oral rota will be given, and pneumonia conjugate vaccine will be given. So all preemies, all low birth weight babies are more prone for death because of high risk nature. And this high risk nature, all vaccine to be given as per a normal baby. It is not because high risk we are not going to give it. Rather, I will tell high risk, no delay should be there. In normal baby, little delay is not going to cause any harm. But high risk baby, if you delay the vaccine, probably the baby can acquire the disease and may die. In that reason, I will tell you this high risk. Why high risk? Because they need vaccine early, they need prevention early. If I am giving vaccine, they are going to survive. And all term babies, those who are well, even if I delay little, nothing is going to harm. So I urge one answer: high risk babies, the vaccination should be given as per chronological age. If I say high risk 6 weeks, go for whatever vaccine to be given. High risk 10 weeks, go for the second dose. High risk 14 weeks, go for the third dose. So this is the way you have to go ahead. And the question, what are the new vaccine? I'll tell you. New vaccine, there is no new vaccine. Whatever vaccine is there, that is, these are the vaccine. But only thing in high risk baby, suppose a mother is high risk mother. High risk mother is going to deliver a high risk baby. So in that mother, I will take care. Mother is immunized with Tdap. I have already told, in order to protect the baby from pertussis, another is flu vaccine. If a mother is pregnant and she is going to deliver a high risk baby which has been detected by the ultrasound, then I will definitely opt for Tdap and flu vaccine during the pregnancy, so that my baby is secured in the first few months of life regarding pertussis and regarding flu is concerned. So that is the reason these are the vaccine I have to take care in the pregnancy. So that is all. And nowadays we are having pabilizumab, because many babies, they are prone for RSV pneumonia, and pabilizumab is a molecule. Prophylactically, it is being offered in the high risk babies in order to prevent this RSV pneumonia in RSV season. So that is not a vaccine, but it is a monoclonal antibody. So that's theoretically or scientifically I can add. But it is not longer days. One day we are having RSV vaccine to be used as a new vaccine in these small babies. It is, the day is not far that RSV vaccine is in pipeline. It has been already used in the older population, 50-year plus. This has been used, and now we are going to have this vaccine for the babies. Once everything is okay, after so many years, or after in this platform also, we may tell our doctors regarding RSV vaccine. But now RSV vaccine is recommended beyond 50, not to the kids.
Right,
Yes,
sir.
sir.
Thank you, sir. Thank you so much for the beautiful explanation. So, with this, we come to an end of the session because there are no more queries from our audiences.
Right,
So, before ending the session, I would like to thank you for putting up your time, your effort, making such a beautiful presentation and presenting it for clearing all the doubts that have come from our audiences. So, sir, thank you so much. Thank you once again. And thanks to everyone for joining in and making the session a successful one.
right.
To all,
Always,
with that,
huh.
concluding.
I from
With
my
that,
side, I
yes, sir.
always thank the IJCP platform for providing this nice platform for dissemination of medical knowledge to our all doctors pan India. That is one. And second, thank you Arpita, because you are the young guys moderating well. So thanks, personally thanks to you and your team, and convey my regards. Always I tell your boss Raja, so he will be happy. And actually he was there in Clarnet. I confused. So
Yeah,
he is there. And finally, all my viewers, those doctors who have logged in spite of their busy schedule. And because if viewers are not there, then how the speakers will be happy? You are
right, right,
moderator, I am speaker. Everything goes to the viewers. So somebody should be there at the receptive end, because they are
right,
there.
right.
Our session is useful and fruitful and everything. So that's why I thank from my core part to all the viewers who logged in, and that's the possible to disseminate a simple thing for the betterment, so that we can save many lives in the ground level. So thank you very much, and namaskar.
Thank you. Thank you so much, sir. Thank you. Thank you.